Today we are going to discuss developing a uniform policy for the disposal of pharmaceuticals and personal care products in California. Our presentation will cover the problem statement, policy problem, disposal methods, governmental failures, and drug donation and reuse programs, just to give a substantial background to our recommendations. We will then discuss our multi-goal solution analysis, political feasibility, and recommendations. This is where we will cover the advantages and disadvantages to each solution, which will clarify why we landed on our chosen final recommendation. The issue that we are exploring is the decentralization of pharmaceutical disposal in the state of California. We find that it would be in the best interest or in best practices to develop uniform policy guidelines for enforcing disposal processes in order to meet federal and state environmental quality standards. The pharmaceuticals and personal care products that we are discussing are a group of chemicals, including but not limited to prescription drugs, over-the-counter human drugs, veterinary drugs, diagnostic agents, nutritional supplements, fragrances, cosmetics, and sunscreen agents. Pharmaceutical and personal care products also include over-the-counter medications, consumer care goods, and prescriptions, which can be introduced to the environment through many different avenues. Due to an ease of access to these items that are intended to improve patients' health, the availability of pharmaceuticals has come with access, safety, and cost challenges. However, the availability of PPCPs without strict regulatory guidelines regarding the disposal of pharmaceutical and personal care products has led to an increased amount of chemicals in the water resources. With many states ruling on the proper way to dispose of pharmaceuticals based on what best fits their public, it's possible to increase water pollution and damage to the environment. For instance, in the state of Alabama, calls for the primary source of disposal is to flush unused or expired medication down the toilet or to be washed down the sink. States like California and Arizona call for pharmaceutical waste to be disposed of by using designated drop-off locations to have the waste disposed of by professional companies. This inconsistency in the regulation of waste can cause unwanted pollution in states that do not encourage flushing pharmaceuticals due to the pollution of water resources like rivers that flow between states. It is recommended that the issue of waste disposal in California be centralized so that all cities and counties are disposing of waste in the same manner. The centralization of waste laws will also require all healthcare professionals to be informed with the same information to help the implementation of policies. The recommendation that will be made for policies in California will consider the federal governmental policies as well as the policies among neighboring states that share water resources. While there are state regulations on disposal, the state of California does not have uniform disposal programs for all of their counties and cities. The framework for our policy will research best practices for program implementation and outline a uniform policy for disposal programs in the state of California. There are no uniform protocols in the United States for safe, environmentally acceptable disposal of controlled substances by patients. In addition, there are conflicting protocols used by various institutions for the disposal of narcotic medications. Although the U.S. Drug Enforcement Administration oversees the prescribing, acquisition, and distribution of controlled substances and works to prevent the illegal diversion of these products, it stops short of recommending specific mechanisms for consumers to dispose of unused medications. The lack of specific regulations in this area increases the risk of illegal diversion of prescription medications and other controlled substances. Our policy alternative A includes a description on the choice architecture which reinforces and/or enhances one of our policy goals. Our goals include economic efficiency, social equity, political feasibility, source control, and environmental sustainability. Each of these goals has its own impact categories, which demonstrate how we would operationalize or measure each of the policy goals. The goal of social equity deals with ensuring there is no particular group of the population who will be significantly adversely impacted, for example, Medicare recipients. Economic efficiency ties into the goal of political feasibility and ensures that the policy alternatives will be able to be implemented. The goal of source control deals with implementing policy which will allow for pharmaceutical disposal to be controlled at either the source of the pharmacy or the government agency overseeing their final disposal. All of these policies are attempting to provide economic sustainability by enforcing and regulating environmental standards which would have already been passed but have not been uniformly regulated across California's cities and counties. In our feasibility analysis worksheet, outlined below, we identify the relevant actors as well as their motivations, beliefs, and resources, and assess the political impact on each of our three policy alternatives. By making a determination of the standpoints of interest groups, elected officials, and unelected officials for each proposed policy alternative, we are able to begin to form a potentially feasible solution for addressing the issue of pharmaceutical and personal care products' effects on the environment and develop an effective uniform policy for the state of California to address their disposal. For environmental issues in particular, there are typically many strong supportive or unsupportive interest groups involved. Oftentimes, they are backed by law firms who strongly advocate on the behalf of environmental consideration. Interest groups for an environmental issue are particularly notable to keep in mind behind elected officials who typically strive to strike a balance to maintain positive relationships with effective compromises with the involved parties. These compromises typically boil down to who will be shouldering the cost of the efforts, which is why economic efficiency is the first goal of our CAM matrix. Based off our multi-goal solution analysis matrix and feasibility analysis, we recommend that the state of California seeks to develop a uniform disposal policy for pharmaceutical and personal care products through the implementation of a tri-level hybridized approach. The first level would be a paternalistic approach of a statewide education and outreach initiative, followed by developing and implementing public sector take-back and disposal opportunity instruction statewide. And the third would be to provide guidance and incentives to the private sector to establish better source control. This tri-level approach would maximize effectiveness, efficiency, and support for the action needed while minimizing regulatory and financial burdens by limiting the responsibility to just one source. As we move through the goals of economic efficiency, equity, feasibility, source control, and environmental sustainability, as well as the potential opposition to our proposed policy alternatives, it became apparent that ultimately it boiled down to who would be burdening the cost and responsibility of the policy. By implementing the Education and Outreach Initiative first, the state of California would be able to address one of the most pressing topics on this issue, which is developing uniform disposal guidelines. As stewards to the environment, wildlife, and to our fellow human beings, the authors believe that it is a Christian responsibility to ensure disposal of PPCPs is addressed fairly, equitably, and effectively as possible. Therefore, it's essential to develop a strategic approach to develop uniform disposal guidelines for the state of California. By splitting responsibility and providing incentive, which fundings can then in turn be used to provide grants for additional public take-back opportunities, no single industry is assigned the responsibility or blame for the issue. Rather, the issue is merely addressed and everyone can do their part to contribute to the mitigation of the negative effects of PPCPs on the environment. Thank you.